Hi there, I'm Lindsay Owens, and I'm going to be talking about spirituality and liberal arts. So, the as a BSN prepared nurse, I can integrate various principles from the liberal arts curriculum in my nursing career. I will be discussing three of those. And the first one is use skills of inquiry, analysis, and information literacy to address practice issues. So, a way that I can integrate that into my nursing career is being a part of the nurse residency program that my hospital has all new graduate nurses be enrolled in. And that is full of starting QI projects and doing evidence-based research with my fellow colleagues on things that I think that the hospital needs to adopt or needs to improve on. And so that is one principle. Another principle is use written, verbal, nonverbal, and emerging technology methods to communicate effectively. Fortunately, I am working in a career that is centered all around different kinds of communication with various different people. So, one of the ways that I can use verbal communication is the telephone translators that my hospital uses. It's like a dual telephone that I pick up and talk to a translator, and then my patient or family member has the other phone, and we're talking back and forth. Another way that I often am communicating with my colleagues is using the SBAR format. And I especially use that when talking to physicians, especially to on-call physicians that don't necessarily know what is going on with the patient, so they need a backstory. During our bedside report, we are always using the SBAR communication for nurses, and that is always very beneficial for everybody involved. Another way is writing a nursing note in the actual patient's chart on any kind of issues that arise or any change of status for a patient. It's always important to do a nursing note, so that kind of covers your back, and if anything were to get brought up later on, you can reflect back on that. And my hospital is also getting these new Cerner telephones, and it's like an iPhone that every nurse will have, and it will text you critical lab values for your patients. It's your app, like it's your phone that you can communicate with, like the physicians or pharmacy or whatever. And it's also has a secured texting for physician communication rather than having to pick up a phone or having to page a doctor. And that Cerner Mobile also, it allows you to scan the patient's meds and their bracelets, so you can do safe medication administration. And all of those are just ways that I communicate effectively in my job. The third principle is integrating the knowledge and methods of a variety of disciplines to inform decision making. So, like I said above, communication is key. So, a way that I can talk to different disciplines is utilizing the pharmacist if there's any medication questions. And I'm lucky that my floor has a pharmacist or two specific for oncology. And so they're always readily available. I can also utilize PT and OT if I'm unsure of how a patient ambulates, or if I just feel uneasy with getting a patient up due to change in status or what have you. I can also page the physician to clarify an uncertain order. So if I see see an order that a physician placed for one of my patients that doesn't quite make too much sense, or I just need clarification, I can always page the physician. And then, in addition to that, upon getting my job on oncology, it is required that all new grads on my floor do an oncology shadow experience. And so I was lucky enough to follow a case manager, pharmacist, PTOT, the nurse navigators that each have like a specific kind of cancer that they attend to if a patient has it on the floor, and they just are there to answer any kind of questions, and they're always there to provide information for not only the patients but us as the nurses. So, as a BSN nurse, I've already displayed that I am committed to lifelong learning. And so, a couple ways that I would continue doing lifelong learning is that I plan on becoming an oncology certified nurse. Since my hospital just became magnet status this past year, there's been a huge push for nurses to become certified, and that is something that I've always wanted to do because from day one, I've always known I wanted to be an oncology nurse. So with that, the OCN, I have to at least have 1 year of practice. So I plan on staying on the floor and getting that year of practice in so I can sit for that test. And then here in a couple of months, I also plan on sitting for my chemo certification, and that would just allow me to hang chemo and do all of that good stuff. And another way I want to continue my education is getting my master's in education. I have always adored my clinical instructors, and I love the role that they have, and I would love to be one of them one of these days. And I would also love to be a nurse educator in the actual hospital. And the nurse educators are always involved in new hires, involvement with evidence-based practice and quality improvement projects. And that is something that I strive to be someday. And lastly, being a BSN prepared nurse that goes to SBU and got my ASN at SBU, they always strive for servant leadership. And so a couple of ways that I can be a servant leader for my patients is to listen to them and actively listen. Don't just be present because I have 1 million things to do, but to actually listen to their concerns. And listen to what the interdisciplinary team is saying so I can advocate for them appropriately. I could also provide empathy and seek to understand the needs of my patients and empathize with them on their concerns and worries. I can provide healing by being there for them in a time of vulnerability. And I can provide them awareness, educate them on the medications or on their new disease processes. And then a way that I can be a servant leader towards my patients' family members is to also listen to them, being present and listening to their concerns and their questions about their loved ones and put myself in their position. That goes along with empathy. Making sure, or just telling myself and assuming that my patients' family members have good actions and good intentions, and they don't just trusting them and being there for them. I could also provide awareness for the family members as well and educate them and put them at ease for their family members' disease and all of that. And persuasion, helping them look at the bigger picture and helping them make decisions for the greater good, whether it's something that they didn't necessarily initially want, but now understand. Also, being there for my coworkers, I could use foresight and learning from previous lessons and conflict management and resolution, commitment to others' growth and investing in others' growth so they can become the best person they can be. And community builders, coming together as one and getting to know each other and sharing the same purpose. And as far as my personal life, I can do stewardship by being responsible for my own actions and thinking about my values and living by them, and committing to the growth of the people by encouraging and motivating myself and the people around me to be the best people we can be. I also believe that the holistic approach is very vital in terms of healthcare because the holistic patient care and spirituality and spiritual reflection has impacted my view of providing holistic patient care by not just medically treating the patient, but with medications and assessments, but actually sitting there and listening to them and their concerns and their nonverbals and providing them comfort and offering a chaplain service if needed. There's lots of factors that go into holistic patient care, and it's being a critical thinker and being there for your patient in a time of need. And that ends my presentation.